Welcome everybody, we're here to talk about the intranasal atomizer device. This device. The intranasal device is actually a very safe way to give medications to your patient. We can use it in patients that if we're trying to give it through an IV or give it through an IM, maybe it'll take some considerable time, and this is a very quick way to access bloodstream or the central nervous system depending on the drug. So I think of a patient that's experiencing a seizure in which we give Versed if you're an advanced care paramedic. Safe route, a safe technique to administer medications to your patients. Plus, maybe you will avoid a needle stick, or maybe your patient's terrified of needles. Wouldn't this be a terrific way to give immunization, for example? So this device delivers a very fine mist into the nasal cavities for absorption to the bloodstream. There's folded structures within the nasal cavities called the turbinates. They have a very large vascular surface area in which these medications can be absorbed. So for an advanced care paramedic, maybe they're dealing with a patient that's in severe pain and is terrified of having more pain through a needle stick. Maybe using fentanyl through the intranasal route would be an effective means of treating their pain. So it's very non-invasive. It's usually tolerated very well by your patient with a rapid onset. So a couple things we need to consider with the intranasal device though, and the amount of medication we give, is the amount that we give per nostril. Ideally, it's 0.2 to 0.3 milliliters per nostril. Within our college courses, it says 1 mil per nostril. Now, the evidence would suggest that this is not as effective, as the medication would not be absorbed as well. And usually the patient wouldn't tolerate that amount of medication per nostril as well. It just leaks out of the nose. So what are some of the medications we can use this route? Well, we have opioids, such as that fentanyl, that synthetic medication, which we could use. Vaccines, benzos, such as Versed for that seizure patient. Just ensure you're allowed to use it. Most often it will be an ACP scope of practice using this. So, how do we use it? Well, whatever medication is ordered, we would use. So we would need our atomizer device, a 1 mil syringe so we can measure specifically what we're going to give to our patient. And remember, we take the total dose and we divide it per nair as we introduce it. The thing to consider is that we would draw actually a 0.1 milliliters additionally into our syringe because there's a dead space within this area of the atomizer which would not be getting to our patient, so we couldn't effectively give the medication. And guess what? These things expire. This has an expiry date. It says to use this by January 1st, 2022. I'm not sure if you can see the date there. So, check everything that you have for medical equipment to ensure that it is not expired. How do we attach the device? Not too difficult, pretty darn simple. 1 mil syringe, pop that out of the paper and back. Done. Maintain cleanliness as much as possible with these things. I like to exercise the plunger in the beginning because there's this little manufacturer seal that occurs when this is made and manufactured in mass. Get a MAD device, take it out of the package with gloved hands. We'll need blunt film needles. Get jar medication. Pop that out of the back of the package. This lure locks together. Don't wreath this on so tight that you can't get it off. I find that's often the problem with some people. Plastic on plastic super tight is very difficult to get off. So just nice and snug, all that's required. Let's leave that cap on there for now. So I think for PCPs, the most common medication that you might give through this route is for a patient that is having an opioid overdose. So what are the signs and symptoms for these patients? Well, very constricted bilateral pupils, decreased respiratory rate, decreased level of consciousness, and maybe decreased pulse and blood pressure, especially those that are gone into an overdose near death. They may have no respiratory drive whatsoever, have a very decreased pulse near death, and their skin color and condition will tell you that, and their level of consciousness for sure. Typically for naloxone, that's all that's required for treatment. That's all that's required to indicate that your patient requires treatment. Naloxone is a very safe medication to use, and you can use some 0.4 milligrams to 2 milligrams. If you use 2 milligrams, you can split up that dose between nares, 0.5 mil per nair. Give it to your patient that way. Could be a life-saving intervention. They could start breathing a little bit over time, which has been my experience. Maybe the blood pressure increases, and then they might be a little surprised to wake up. Don't worry about them swinging and smacking you, being violent. That is actually an unproven thing. Always be cautious though. So I'm gonna do something I don't commonly do. That's withdraw medication from a syringe. That it just fits in there, and I'm going to demonstrate taking out naloxone. So what is naloxone supplied in? Crap, I don't know. Guess what I have to do? I have to check my app to make sure that I don't give the wrong concentration of a medication. So I'm back. So naloxone is supplied in 0.4 milligrams per 1 mil. So if I have 1 mil in my syringe, I should half the dose, which gives me 0.2 per nair for a total dose of 0.4. This could be our initial dose, especially if we're trying to hunt around for an IV in a patient. It might be difficult to give to. Simple, quick procedure to get this ready. Let's take that blunt fill off so I'm not waving this around very dangerously. I'm glad you're not in the room with me. Might have stabbed you. My total dose, which I'm going to split between nares. Lure lock this device without touching the end. That's going to go into my patient with gloved hands on. I don't have the luxury of gloves at home while I'm demonstrating this. And this just lands nice and gently into the nose. I will do a quick demonstration of how this is done on a live seizing patient. I just got to go find one. So we want to sit that into the nasal area so that it seats very well. So we don't press it too hard, we just have to make sure it's got a nice seal around the nares. So one thing to know about these things is how fast should you push this plunger? This is very important. For example, look what happens when it's too slow. Drips out. We don't want it to drip in the nares. So we want to push this briskly. Let's press it too fast and see what happens. Actually, you know what? Press it fastly. That worked wonderfully. Did you see that fine mist? I'm gonna do that again. Okay, everybody, we've been dispatched to the home of a 16-year-old female that because of COVID has to do online studies at home right now. So she's been home alone all by herself. She got access to fentanyl and she took it. Now we're getting called for an overdose complaint. According to police, she has a decreased respiratory drive. She is unconscious and not breathing obviously well. Let's go in, we're gonna examine her pupils. We're gonna drop our medication preventatively or prophylactically so that we're ready. So we have our 1 mil syringe attached here to our atomizer device. Now you can give this medication IM as well, but this is another quick route alternative. Let's go in. Okay, we're approaching our patient. We already have a poor general impression. The scene is safe, police are behind us. We've just done our head-to-toe exam. We find our patient not even breathing a bit. She obviously has clean nostrils and we have access to our medication right here. How about having the dose, so 0.5 mils per nair, and see if we get the desired effect, which is an increased level of consciousness. All indications for the medication are given. Let's give 0.5 per nair. So we seat it gently into the nair. You're not supposed to be conscious. And now we give it a brisk motion. There we go. Let's see how much medication I gave. Goodness, 0.4, I'm off by 0.1 mil. We have too much nose, last nair. Nice brisk motion. Patient tolerates it really well. Let's get her some napkins next.